Stage 4 kidney disease. Critical symptoms and strict diet you must follow. Have you been feeling exhausted lately, even after a full night of sleep? Maybe your ankles look a little puffy, or you just have this uncomfortable feeling that something is not quite right with your body, but you cannot put your finger on it. Today we are talking about stage 4 kidney disease. What it actually means, the critical symptoms your body is already trying to warn you about, and the strict daily diet that can make a real difference to how you feel and how well your kidneys continue to function. By the end of this video, you will know exactly what is happening inside your body, which warning signs you should never ignore, and what to put on your plate every single day to give your kidneys the best possible chance. So stay with me, because every part of this video matters. Understanding kidney disease. Let us start from the beginning, because before anything else makes sense, you need to understand what your kidneys actually do for you every single day. Your kidneys are two small, bean-shaped organs sitting quietly in your lower back, and they work around the clock without you ever having to think about them. Every single minute, they are filtering your blood, pulling out waste, removing extra fluid, and sending clean blood back around your body. They also help control your blood pressure, keep your bones strong, and tell your body when to produce more red blood cells. They are, in every sense of the word, essential. Now, kidney disease does not happen overnight. It develops gradually, and doctors measure its progression using something called stages, from stage 1 all the way through to stage 5. Each stage is based on how well your kidneys are still able to filter your blood. This measurement is known as your filtration rate, and it simply tells you what percentage of kidney function you still have working for you. At stage 4, your kidneys are still working, but they're only functioning somewhere between 15 and 29% of their normal capacity. To put that into perspective, imagine a filter in your home that is so blocked and worn down that it can only do about a fifth of the job it was originally built to do. The water coming through still looks mostly okay, but over time, things start to build up that should not be there. That is exactly what happens inside your body at stage 4. Waste products and toxins that your kidneys would normally remove start to accumulate in your blood. Fluid that should be flushed out begins to build up in places it should not be. And your body, which has been quietly compensating for years, starts to struggle in ways you can actually feel. This is why stage 4 is considered a serious stage. Not because it is the end of the road, but because it is the point where your kidneys need much more support than they have been getting, and where the choices you make every single day start to carry much more weight. Here is something important to hold on to though. Stage 4 is not stage 5. You still have kidney function. You still have meaningful options. And many people at this stage, with the right diet, the right habits, and the right awareness, are able to slow the progression significantly and maintain a decent quality of life for a long time. What tends to make the biggest difference at this stage is not just medication or medical appointments, as important as those are. It is the daily decisions. What you eat, what you drink, how you manage stress, and how closely you listen to what your body is telling you. Those things add up in ways that truly matter. Understanding your condition is not something to be afraid of. In fact, it is the most empowering thing you can do right now. Because the more clearly you understand what is happening inside your body, the better equipped you are to respond to it in a way that actually helps. Before we go any further, I want to ask you something personal. Are you watching this because you or someone close to you has recently been told their kidneys are at stage 4, and you are trying to make sense of what that actually means for daily life? If that is you, type 1 in the comments right now. If you are here because you are trying to get ahead of this and protect your kidney health before things get worse, type 0 instead. I read these comments, and knowing who is in this community helps me create content that genuinely serves you. And if you want clear, honest, practical kidney health guidance every single week, subscribe to this channel and turn on the notification bell. There is information coming that you will not want to miss. And that is exactly what the rest of this video is going to help you do. Starting with the symptoms, because your body has likely been sending you signals for a while now, and it is time to learn how to read them properly. Early and critical symptoms. So your kidneys are under serious pressure at stage 4, and your body knows it. The problem is that most people either do not recognize the signals, or they put them down to getting older, being busy, or simply not sleeping well enough. That is an easy mistake to make, because these symptoms are not always dramatic. They creep in slowly, quietly, and they blend into everyday life in a way that makes them very easy to dismiss. Let us change that right now. The first and most common symptom is persistent fatigue. Not the kind of tiredness that goes away after a good night of sleep, but a deep, heavy exhaustion that seems to sit in your bones no matter how much rest you get. This happens because when your kidneys are not filtering properly, waste builds up in your blood, and that toxic buildup affects your entire body, including your energy levels. On top of that, damaged kidneys often struggle to send the right signals for red blood cell production, which means less oxygen is being carried around your body. Less oxygen means your muscles and your brain are constantly running on empty. The second symptom to watch for is swelling, particularly in your legs, ankles, and feet, and sometimes around your face and eyes, especially in the morning. When your kidneys cannot remove excess fluid efficiently, that fluid has to go somewhere, and it tends to settle in the soft tissues of your body. If you have noticed that your shoes feel tighter than they used to, or your face looks slightly puffier when you wake up, that is not something to brush off. Changes in urination are another signal worth paying close attention to. You might find yourself needing to go more frequently during the night, or noticing that your urine looks foamy or frothy, which can indicate that protein is leaking through your kidneys when it should not be. Some people notice their urine is darker than usual, or that they are producing noticeably less of it. Any of these changes are your body waving a flag. Shortness of breath is something that many people with stage 4 kidney disease experience, and it often catches them off guard. This can happen for two reasons. Fluid can build up around the lungs when the kidneys are not managing it properly, making it harder to breathe comfortably. And as mentioned, lower red blood cell levels mean your body is working harder just to carry oxygen, leaving you feeling breathless even during light activity or sometimes even at rest. Then there's difficulty concentrating, sometimes called brain fog. If you have been finding it harder to focus, feeling mentally slow, or struggling to remember simple things, this is not just stress or age. Toxins accumulating in the bloodstream can affect how clearly your brain functions, and it is a symptom that significantly impacts daily life in ways that are easy to overlook. Finally, pay attention to your skin. Persistent itching, particularly on the back, arms, or legs, along with dry, dull, or slightly discolored skin can be signs that waste products are building up in the body and finding their way to the surface. None of these symptoms should be met with panic. They should be met with action. Because once you understand what your body is telling you, you have the ability to respond, and that response starts with what you choose to put on your plate every single day. Daily diet you must follow. Now that you understand what is happening inside your body and what your kidneys are trying to tell you, the next question is a very practical one. What do you actually do about it? And one of the most powerful answers to that question sits right in your kitchen. Diet at stage 4 kidney disease is not just a recommendation. It is one of the most direct ways you can reduce the burden on your kidneys every single day. Every meal you eat either adds pressure to those already struggling filters, or it gives them a little breathing room. Once you understand that, food stops feeling like a restriction and starts feeling like something genuinely within your control. Let us start with what you should be eating. White rice is one of the most kidney-friendly staples you can include in your daily meals. Unlike whole grain options, white rice is lower in phosphorus and potassium, which makes it much easier for your kidneys to handle. It is filling, versatile, and easy to prepare, making it a reliable base for many meals throughout the day. Cauliflower is another excellent choice. It is low in potassium, low in phosphorus, and gentle on the kidneys while still being genuinely nutritious. You can steam it, mash it, roast it, or add it to soups. It is one of those vegetables that works in almost any meal without much effort. Cabbage, both green and red, is similarly kind to the kidneys and contains useful nutrients without the high mineral load that your kidneys would struggle to process. Garlic is a wonderful flavor addition that also brings natural anti-inflammatory benefits without putting stress on kidney function, making it a smart swap for salt when you are seasoning your food. When it comes to protein, your kidneys at stage 4 need you to be careful with portion sizes rather than eliminating protein entirely. Small, controlled portions of lean protein such as chicken, fish, or egg whites give your body what it needs without overwhelming your kidneys with the waste that comes from breaking protein down. Think of it as quality over quantity at every single meal. Now, let's talk about what needs to come off your plate, because this part is equally important. Potassium is a mineral that healthy kidneys manage with ease, but at stage 4, too much of it can build up in the blood and cause serious problems with your heart rhythm. High potassium foods that need to be strictly limited include bananas, oranges, potatoes, tomatoes, and spinach. This does not mean one bite will cause harm, but regular, large portions of these foods add up quickly and put unnecessary strain on your kidneys. Phosphorus is another mineral to take seriously. When kidneys cannot filter it properly, it pulls calcium from your bones and can lead to further health complications over time. Foods high in phosphorus include dairy products, nuts, seeds, dark colas, and most processed and packaged foods. Checking labels and reducing these consistently makes a genuine difference. Speaking of processed foods, they need to largely disappear from your daily routine. They are loaded with hidden salt, preservatives, and additives that your kidneys simply cannot handle at this stage. Ready meals, crisps, tinned soups with added salt, and fast food all fall into this category. Salt itself deserves special attention. Excess sodium causes fluid retention, raises blood pressure, and forces your kidneys to work even harder. Cooking from fresh ingredients and seasoning with herbs and garlic rather than reaching for the salt shaker is one of the simplest and most effective habits you can build. Small, consistent changes to what you eat every day genuinely add up. And as you will hear in the final part of this video, it is those small daily choices, repeated over time, that carry the most real and lasting weight. If you are finding real, practical value in what you are learning here, please take just a second to hit the like button. It costs you nothing, but what it does is quietly tell the algorithm that this information matters, and that pushes it in front of someone else who is sitting at home right now, exhausted, confused, and desperately searching for answers about their kidney health. Your one click could be the reason they finally find what they have been looking for. That is not a small thing. That is genuinely meaningful. You made it to the end of this video, and that tells me something important about you. You are not someone who is willing to just sit back and hope things improve on their own. You are someone who wants to understand what is happening and do something meaningful about it. That matters more than you might realize. So let us bring everything together, because you have covered a lot of ground today, and you deserve to leave here feeling clear rather than overwhelmed. You started by understanding what stage 4 kidney disease actually means. Your kidneys are still working, but they are functioning at somewhere between 15 and 29% of their normal capacity. That is serious, and it deserves to be taken seriously. But it is not the end of the road. It is a point where your awareness, your daily habits, and your choices carry real and genuine weight. Your kidneys are still fighting for you, and now you know how to fight alongside them. You then learned how to read the signals your body has likely been sending for some time. The deep exhaustion that sleep does not fix. The swelling in your legs and face that you may have been putting down to something else. The changes in urination that are easy to overlook. The shortness of breath, the foggy thinking, the persistent itching. These are not random inconveniences. They are your body communicating with you, and now you understand the language. From there, you moved into the most practical part of this conversation, your diet. You now know which foods support your kidneys and which ones add unnecessary pressure to an already difficult situation. White rice, cauliflower, cabbage, garlic, and controlled portions of lean protein are your allies. High potassium foods, high phosphorus items, excess salt, and processed foods are the ones that need to step back from your plate. Not because eating well has to feel like punishment, but because every meal is genuinely an opportunity to either help or hinder your kidneys, and now you know the difference. Here is what I want you to hold on to above everything else. Stage 4 is not a verdict. It is not a full stop at the end of a sentence. For many people, the right knowledge combined with consistent daily action has made a profound difference to how they feel, how slowly their condition progresses, and how much quality remains in their everyday life. You cannot change your diagnosis overnight, but you absolutely can change what happens next. Start small if you need to. Swap one processed meal this week for something fresh and home-cooked. Remove the salt shaker from your table. Add cauliflower to your next dinner. Drink enough water, but not excessively, and always follow your doctor's specific guidance on fluid intake at your stage. One small step, taken today and repeated tomorrow and the day after, builds into something that genuinely shifts the picture over time. Your kidneys have been quietly working for you your entire life. This is your chance to work for them in return. If this video helped you understand something you were confused about, or gave you even one practical thing you can act on today, please give it a thumbs up. It helps this channel reach other people who are quietly searching for this exact information and do not know where to turn. If you have a question, a thought, or something from your own experience you would like to share, leave it in the comments below. This community is built on real conversations, and every comment genuinely means something here. And if you want to keep learning how to protect and support your health in a way that is clear, realistic, and grounded in everyday life, then subscribe and turn on notifications so you never miss a new video. Thank you for watching, for staying, and for caring enough about your health to be here today.
That is never a small thing.